Step 51, optimization of frozen embryo transfer cycle. There are two big group of factors which determines your success or failure in IVF. First group is linked to the embryos. Second group is linked to the uterus. So between embryo and uterine factors determines your success in IVF. From embryo point of view, you want to have a high-grade blastocyst embryos. From the uterus point of view, you don't want to have any problems. You don't want to have any structural problems, any chronic inflammation. Let us say you did a fresh IVF cycle or fresh IVF cycles and banked 4 high-grade blastocyst embryos. Each of these embryos have approximately 35% chance of becoming a baby. Let us say if you have 4 high-grade embryos, you can assume 1 in 3 chance for each embryo, and cumulative chance for one child is 80%, provided everything is optimal for these embryos in terms of uterine factors. So if there isn't any uterine problem, then when you transfer, you're likely to get that outcome you expected, 1 in 3 for each embryo, or 80% chance of having at least one child using these 4 high-grade embryos. But if you have some uterine problems, the odds of success for each embryo and cumulative odds can be reduced. Generally, there are 2 big group of factors cause problem with implantation, which is linked to the uterus. One is a chronic inflammation of the uterus or pelvis, or structural damage or structural problems of the uterus. In terms of chronic problems, by far the biggest causes of chronic inflammation of the uterus is adenomyosis and endometriosis, especially moderate to severe endometriosis. There are 4 big problems or common problems you can see from structural point of view. These are fibroids, especially submucous fibroids, endometrial polyps, uterine septum, and hydrosalpinx. If you have these conditions, you have a lower chance of success per embryo or lower chance of success cumulatively. Let us say if you had a 35% chance of success for each embryo, if you have these problems, your chance can be reduced. Let us say maybe depending on severity of these conditions to 20%, 1 in 5 for each embryo, or cumulative chance of success for all 4 embryos can be reduced from 80% to 60%. That's not ideal situation because you have done the hard work and created high-grade embryos. Now you want to give best chance for each embryo to implant. For that, if you have any suspicion of any of these conditions, you need to do further investigation. You can do deep pelvic ultrasound scanning, or you can do MRI scan, especially if you suspect adenomyosis. You need to do MRI scan because MRI is a gold standard for diagnosis of adenomyosis. And you may need to do laparoscopy and hysteroscopy procedures if you're suspecting endometriosis or structural problems. And you need to fix those problems before you go ahead with frozen embryo transfer cycle. A lot of these problems you can fix surgically, and some of the problems you need to fix with medical treatment, like adenomyosis. You need to suppress the pituitary long enough to let it heal itself. So essentially, this is called 3-stage IVF treatment, which means if you're suspecting any of these conditions before IVF or during fresh IVF cycle, then the first stage is you do banking of embryos. You bank sufficient number of high-grade embryos first without transferring. Second stage is the treatment of this chronic inflammation or structural problems of the uterus, medically or surgically. Then the third stage is a frozen embryo transfer cycle. Here you are approaching very systematically, not sporadically, and hoping that success will happen if you transfer the embryo. You are approaching systematically and giving each embryo best chance for implantation and getting high chance of success cumulatively. That's why you need to be very systematic from the beginning of your IVF cycle. You need to look out for symptoms of these conditions. If you see any of these conditions, you should not rush. You should try and freeze those embryos, then treat these conditions, then transfer embryos in frozen embryo transfer cycle. The optimization of success of frozen cycle should happen from outset, from the beginning, and you should discuss this with your specialist if you think that you may have any of these conditions before you do frozen embryo transfer cycles. If you do that, then you should have a very optimal and good chance of success in frozen cycles.